Hi and welcome to #Podblog. I'm Tom.
I'm Hannah.
And today we're talking about shockwave therapy. So we're going to go through a series of questions that I think everyone who's considering having this treatment would probably want to hear. First question, what is shockwave therapy?
Okay, so shockwave therapy has been around for a number of years, but only recently it's been used in the treatment of tendons. So medical shockwaves are delivered through an applicator and it targets injured tissue that's not healing. So it's clinically proven to produce an inflammatory response. It increases circulation to surrounding soft tissues, reduces pain felt by nerve fibres, and it begins the healing process by activating the stem cells.
So what conditions can you treat?
So we treat chronic lower limb conditions, so that could include plantar fasciitis, Achilles tendinopathies, shin splints, Osgood-Schlatter's disease, a number of conditions really.
Okay, so I've had for example, I've had pain for a few weeks. Will this treatment help me?
It actually works better if you've had your injury for sort of over 3 months, so chronically. So if you've tried stretching, strengthening, orthotics, changing footwear, maybe a steroid injection, and you haven't had any improvement, then shockwave could be the next line of treatment.
Oh, cool. Does it hurt?
It's a bit uncomfortable. It's not designed to hurt you. It should be bearable. There are settings which we can change to make it more bearable for you.
So you sort of go to, I guess, patient tolerance initially?
Yeah, everyone obviously has a different pain threshold, so we communicate with the patient throughout the whole treatment.
And then you sort of increase it, I guess, as the pain decreases.
Often people get a numbness, so it's likened to if you were to eat a really hot chili. First off, it's really painful, your mouth's really uncomfortable, and then it numbs, and that's the same substance that's released with shockwave.
Ah, okay. Mm-hmm. How many do I need?
So we recommend 3 to 6 treatments. Obviously it depends on the severity of your injury. We would start with 3 treatments spaced every 7 to 10 days apart. Probably after the 3, leave it 4 weeks, and then if no improvement, go for another 3.
I guess it depends on, well, a number of things. It can be down to the patient's ability, I guess, to recover through shockwave, level or how chronic that actual condition is.
And although shockwave is great, it works better in combination with a stretching or strengthening program, wearing the right footwear. If you're prescribed orthotics, all of these things will definitely help together.
Okay, so you said every sort of 7 to 10 days is the best time frame between appointments.
Yeah.
Will it be painful after the treatment?
It shouldn't be. Like I said, with the numbing effect, people often get that for about 24 hours after treatment, and then symptoms should really decrease then as the treatments go on.
Because I think I had it in my shins when I started to run, so I had medial tibial stress, so very painful up the inside border of my shin, and Hannah was kind enough to shockwave my shins, which was, I don't know, bearable. Not the most pleasant, but certainly I found immediate relief when I got up off that bench. You know, it was, I can believe the difference that it made. It was short-lived, but massively, over a period of a few treatments, that massively improved my
what's
symptoms.
Really important is 24 hours after treatment that you don't do any high impact strenuous activity, because we have that numbness and we think, great, we're better. We're not. It's just those effects in the first 24 hours. So
that sort of goes in then with the restrictions. That was my next question, really. The restrictions after treatment. So you say no high impact activity.
For about 24 hours. Because we're trying to get an inflammatory response as well, we say to avoid ice in the area, and if you can avoid taking anti-inflammatories throughout the sessions as well, that can help with the recovery.
So are there any reasons that would stop me from having this treatment?
So before we go ahead with the treatment, we'd have to go through a medical checklist. So if you had a pacemaker, blood thinning medication, diseases of your nerves, blood vessels, we would not go ahead and do that.
Okay. And are there any risks or side effects to it?
The great thing about this treatment is it's really low risk, so you might get some reddening, swelling, bruising around the area. Also, we wouldn't do treatment if you'd had a steroid injection in the area in the last 8 weeks, because that could cause tendon rupture.
I think from my point of view, and certainly learning about shockwave therapy over the last year, it's the evidence as well. The evidence that goes that sort of sits behind this. It's so good. I mean, the responses we've been getting.
We've had amazing responses. It's even shocked us as clinicians, hasn't it?
Yes, it has shocked us. So I think that sums up shockwave therapy. If you have any more questions, feel free to get in touch, pop us an email, or get on our Facebook page.
And we've also got a video which is actually me demonstrating the treatment of Achilles tendinopathy, which is quite good to watch
on our YouTube channel. Fantastic. Well, thank you for listening. Have a lovely Christmas.
Yeah, Merry Christmas and Happy New Year to you.